Well, I think there are really two main challenges that Canadian healthcare is facing. The first is around quality. And by quality, I mean two aspects of quality. The first is actual the care that people receive. But the second is really about the setting in which care is provided. We spend too much money and we have patients too often in acute care when they don't need to be there. They can be cared for in the community, residential care facilities, at home, places they much prefer to be. And I think we need to make that shift from the acute care system into the community because it will be better for patients and better for quality of life and those aspects. The second biggest challenge we have, of course, is sustainability. Healthcare has grown to be the majority of the budgets in the provinces, and we need to moderate that because economic growth is not keeping up. And so we need to be able to have a sustainable system. And part of sustainability actually does tie back into the quality aspects that I spoke of, because it is actually, not only is it better for the patient from a quality perspective to be cared for at home, it's actually cheaper for the system as well. So those would be what I would see as the two main challenges of healthcare. Well, I see HealthCareCAN clearly as an organization that provides a suite of services to be able to assist in this regard. So for example, we provide education, so we provide residential care management, for example. We provide a whole array of training and education that helps people within the system because when we have to build capacity in our people as well. The second is that we have a strong emphasis on research and innovation. So as we make these shifts and as we continue to support the acute care system, because although we're making a shift to the community, that doesn't mean we lose focus on acute care. We still have to provide high quality acute care. So we have a whole research and innovation agenda that we are promoting within the country at the federal level, which is primarily where the funding comes from. And I guess the third aspect where HealthCareCAN can really contribute is actually to advocating for and linking the changes in the different sectors of healthcare. So for example, advocating and supporting the shift from the acute care sector by investing more money in home care, for example. Because HealthCareCAN is uniquely positioned. They are a pan-Canadian organization. They represent the entire country. So they represent the entire country, but also the entire continuum of care and the research agenda. We are unique in that sense. We are the only organization that focuses in on those areas. And there are many organizations in Canada that are involved in this realm, but I think we have a very unique role. We support acute care, we support home care, we support the shifts in health care that need to happen. We also support training. We provide excellent training programs that are actually specifically designed for our healthcare settings. They're not canned coming in from somewhere else. They've actually been developed in the Canadian settings. And we also support a robust research and innovation agenda. And one of the forebearers of HealthCareCAN was ACAO, the Academic Health Sciences organization. And so we strongly support that agenda, and we are advocating for it and providing forums for important discussions around research and innovation. So for those reasons, I think HealthCareCAN is uniquely positioned, and I would encourage anybody to become a member.